Welcome, welcome. Today's topic is how to choose a gut-friendly fiber supplement. Fiber is incredibly important for gut health. It's that basic, it's the ground, it's what helps gut microbiome. And with today's availability of supplements, peptides, nutraceuticals, medications, obviously that are life-saving often, we need to understand that without good gut health, many of these are not working efficiently. If you're not absorbing right, if you have an issue, an interaction, and you don't know about, so let's dive in. I'm Dr. Ina, by the way, at Digestive Reset. I'm a doctor of pharmacy, functional medicine practitioner, and I'm in the world of functional medicine since 2009 for over 16 years, concentrating on gut health and hormone health, specifically with Crohn's and colitis clients that came to me after I overcame Crohn's myself. And despite knowing all about medications, I chose the functional medicine way. Let's dive in and let's talk about fiber today. Basics, incredibly important for that good gut health. Uh, we want to understand how to craft your gut-friendly fiber supplement because without having fiber in your diet, you can't expect your microbiome to be effective, to have those great species, important species to be fed well. The food needs to be delivered for optimal health. So we need to be looking in a gut-friendly supplement. We need to be looking for quality ingredients, palatable form, something you like, flavor that you like, texture. It has to mix well because if it's chunky, you're really gonna hate it and not take it. And it needs to go well with your plan if you're on probiotics as well. You need to choose a product that's really clear. It says on the label if there's any allergies to any specific ingredient, it has to be really clear. And before you choose a fiber supplement, you have to ask yourself a really good question. Am I taking enough fiber with my diet? That's a really good first step. Why? Because food is always first. Please remember, supplements are addition. Lifestyle changes and food first. And if it's hard for you to get that fiber in, which it can be for some, especially for a lot of my clients that are having gut issues, chronic gut problems, inflammation, inflammatory bowel disease, it pains them, it hurts to eat fiber foods. Sometimes it's easier on their gut to use a gut-friendly fiber supplement. Why is fiber that important? Why do we even concern ourselves with taking enough? First, like I mentioned, it feeds that good bacteria, good species. Fiber acts like the prebiotics. You probably heard about prebiotics, probiotics, postbiotics. I talk so much about it. You could watch it on my YouTube channel. You could now go into my Substack and get plenty of information there. Fiber acts as a prebiotic, nourishing beneficial microbes and promoting balanced, thriving gut microbiome. So food basics necessary. It also promotes regularity. So people that are having constipation without realizing that constipation is a big red flag. Some are used to it and think it's the norm. If they're being told that going to the bathroom a couple of times a week or once a week is okay, it's absolutely not. You need to go to the bathroom at least once daily. Otherwise, you are considered constipated. So fiber will support consistent, healthy bowel movements as it helps prevent constipation and irritability. Key here. And it also works as a gut barrier support. Adequate fiber intake makes it stronger. The lining is now stronger, reducing inflammation and permeability. Not many are talking about that. We have that leaky gut support with L-glutamine, which is fantastic. I have practically most of my clients on it, including myself. But fiber also can act, the appropriate fiber can act as that support for the lining. Now you need to understand different fiber types. Really effective fiber supplement, it requires both types that work in harmony. They kind of complement each other. They're a little bit different. One is soluble fiber and one is insoluble fiber. So soluble fiber, it dissolves in water to form gel-like substance. It helps lower cholesterol and stabilize blood sugar. Key for any client, patient with inflammation, because blood sugar goes hand in hand with anyone with inflammation. The moment you're inflamed, your cortisol is out of whack and your blood sugar becomes also an issue. Insulin resistance is right there lurking. So stabilizing blood sugar is a key. Also, the end result will be reduced inflammation. And key sources would be psyllium husk, fantastic, and beta glucans. Also, it's important to understand those. Insoluble fiber, it does not really dissolve in water well. It adds bulk to stool, which is very important for some, and it accelerates transit time through the digestive tract. Key sources include cellulose and wheat bran. Again, wheat for anyone with celiac disease is not an option. That leaves you with cellulose. So a balanced, good supplement will have both soluble and insoluble to get both benefits. And looking for quality product is very, very important. So these are the typical gut-friendly fiber ingredients here. Psyllium husk is one of those. A powerful soluble fiber with the proven bulking and prebiotic properties, the gold standard of fiber supplements, and it's gold standard for a reason. It's safe, it's tolerated okay for even for those with inflammatory bowel disease, as long as you do it right. You start low, go slow. Inulin chicory root is also used as a prebiotic. It selectively feeds bifidium bacteria and other beneficial bacteria species. So it improves microbiome diversity. So without taking an additional probiotic, you already will improve your probiotic diversity. Next one is flaxseed meal. So that's just great on its own, not even as a fiber product. It's great omega-3 source. It has protein. It delivers both soluble and insoluble fiber, plus anti-inflammatory omega-3 fatty acids. My suggestion always with flax, you mill it right before using it, whether in a shake, in salad, or any other way that you prefer to use it, as long as you mill it right before, not to lose some effectiveness. And then we have other things like apple pectin or acacia fiber. Acacia fiber is tolerated really well for many, and it usually requires less time titrating the dose up. So that's something you might consider to start before you even go with psyllium. And it's gentle, highly tolerable. And apple pectin is also great for regulating blood sugar. So you kind of kill two birds with one stone. I pick and choose depending who is the client. I do like to recommend individually only, but these are your basics and really good starting point. And back to remembering diet, lifestyle changes, targeted supplementation. I've done it for so many years for my clients, and it's that important before you go for your next round of stacks and injections, because not even all injections will be going through your system without affecting your gut. People often think if it's an injectable form, it will bypass your liver or the gut. Not everything, not at all. Often it needs to be bypassed by the liver. Um, so remember that. Avoiding common pitfalls and what you don't want in your fiber supplement. Excessive sugar. No one wants that. So, but also look for artificial sweeteners. What's worse? Having a lot of sugar or colors of sweeteners that are now known to be cancerogenic. We want to be very careful choosing and selecting. Also, irritating fillers and binders that can be painful sometimes if for those with inflamed gut. Low quality, untested ingredients, things that are found and are common websites where everybody goes to buy stuff. You have to be choosy. You have to find a good quality products, professional grade, proven companies that test their products. It's incredibly important. And the key is to always start low. I recommend that even for those that don't have inflammatory bowel issues, just start low. If you have low diversity, if you have some kind of digestive symptoms that are just mild, or even no symptoms at all. Your best bet just to avoid flatulence, gassiness, because no one wants that. Start low, optimize solubility, ensure that ingredients are dissolved, and use plenty of water. Me, working as a community pharmacist for so long, I had people coming in telling me I did everything right. I took the scoop and I asked how much water, and they told me like the same amount. I've heard that so many times. Plenty of water with fiber supplements. It's very important to be able to get the effect and results. When it gets tricky, if you are taking a lot of other supplements, where do you fit in taking this with so much fluid? And that's why you have to be working with someone that understands nutraceuticals, pharmaceuticals, somewhere in between, that you could take those and feel safe, and it will be effective for you. You also want to get stronger microbiome, obviously, with the right fiber supplements. You want to give it sufficient amount of time for it to start working. 2 to 4 weeks usually is that perfect time to let it work. What's often missed is the fact that many fiber supplements could potentially have drug herb interaction, drug supplement interaction. Psyllium theoretically might increase, or have some kind of effect on oral drugs, because it has that ability to suck in the water, right? Become gel-like product, and it can take away, like suck in that product. What's highly recommended is to avoid taking anything that's important, especially medications, at least 30 to 60 minutes. Try to do 30 to 60 minutes apart. So consider taking psyllium after you've done taking your supplements and medications. and wait for 30 to 60 minutes and then take your psyllium. For many, it's taking at bedtime is that ideal timing. Um, Back to staying consistent and understanding what your gut needs, because we all have those unique needs, and what could work for someone else doesn't have to work for you. Be mindful of that. And I'm always here with my resources on my website, digestivereset.com. Happy to be your source of information. Please find me on Substack now. Drop a comment if you have any, and I will see you next week.